All right, Kentucky, it is 5 o'clock, a time we come together every single day in the midst of this worldwide pandemic to remember that we're going to get through this, and we're going to get through this together. Say it with me. We're going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. We know it. We say it. And we feel it, and that's one of the reasons that you have done such an amazing job, and continuing to say it and know it and feel it is how we are going to continue to do the good job that it is going to take as we move through this into a new normal until ultimately we have a vaccine and get back to the old normal. It's how we protect one another and continue to pass this test of humanity. So this week, we are recognizing Medical Laboratory Professional Week. Think about that during this week with all we talk about in testing and the rest. This is the annual celebration of the medical laboratory professionals and pathologists who play a critical role in healthcare and patient advocacy. We are so thankful for the laboratory medicine profession, to every lab professional out there working at this time. Thank God. That you are with us, and you are a reason that we're going to get through this and get through it together. We're also going to get through this because we are going to follow the 10 steps that it takes to defeat this coronavirus. Yes, we talk about it every day at the top. This is our mantra. This is what has to be muscle memory for us. This is what we have to make sure is top of mind every single day because it saves lives. And number one is healthy at home. We're talking a lot about healthy at work, but even when more of us get to be healthy at work, when you're not there, you're healthy at home. You know, it's expanding things a little bit, but understanding that limiting those contacts is still absolutely critical. So if you're not healthy at work, you're not getting supplies, or you're not getting exercise, you need to be healthy at home. We've come too far, and we have done too much to let up now. Avoid crowds and gatherings. There isn't a number that's okay. All crowds, all gatherings we've got to avoid. If you see crowds over this weekend at any stores or other areas, just don't be a part of it. You don't want to be that extra person that is in the midst of it. Not being a part of it protects you and also protects the people around you. Practice social distancing. Know when to seek care. But let me just say, we've got some people that are coming to the ER pretty late that were really sick beforehand. Seek care if you really need it. Seek care if you really need it. kycovid19.ky.gov. You know, every day as we've led up to the restrictions we've put into place, but also every day that we're able to provide guidance and open things up a little bit, this is where you need to go. Our guidance for industry, our guidance for different areas, the answer to your questions, so much of it will be right there. Make sure you're getting your information from a credible source. Wash your hands and surfaces. So, as we work on becoming healthy at work, as we slowly and gradually reopen the economy, and it will be slow and gradual, guess what? People are going to have more contacts. There's going to be more of a chance for the virus to spread. So this will become more important in the weeks to come than it even has been in the last couple weeks. Apply for benefits. So I saw a story today that we are one of the top states in number of new people getting unemployment benefits. Folks, that's what everybody around the country, they're in the same spot. What we are doing is we are signing more people up per day than other states are, even with the claims and applications they have. Now, to everybody we haven't gotten to, that is not an excuse. And just because we've been told we're doing it better than other states doesn't mean it's okay we haven't reached you. We will. Everybody apply for benefits. Prioritize your mental health. I've struggled with this. I know that each of you have too. Find those things that lift you back up, that help you continue. We still have, a road ahead of us. We can see the light at the end of the tunnel, but we're walking towards it. We're not riding towards it. So make sure that we stay strong. Don't travel and report non-compliance. So we always talk about the 10 steps plus one. Fill out your census. And you know what? we have, this is how to do it. It doesn't take long at all. You can do this in a couple of minutes, and it is your legal obligation. And for those that have internet access and you are at home, come on, folks. There's no excuse. It's going to help us rebuild. Just spend a couple minutes. You've done so good of a job at being a part of Team Kentucky. Do this one extra thing for us. And here's an update on how we are doing. So we have moved up one spot to 16th. So take that, Oregon. But we've got to go a long way further. I mean, if you look at 54.6%, if 3% of Kentucky, 3% of our households, 3% went on tonight, filled out their census, we'd be in the top 10. 3%. And that's where we need to get. We need to get to that point because those are dollars that are going to flow in. Those are dollars that are going to help us rebuild. Those are dollars from the federal government that we don't get if people don't fill out their census. So sign up and do your census. I did want to point out a couple of things, though. So we have at least some sixth-class cities in one of our larger cities and some others that are in the top 10 in the country in responding to the census. So just like I want to push and encourage everybody to do more because 16th isn't good enough in Kentucky, I do want to say to Norburn Estates, I actually lived first house I ever bought for 5 years in the smallest house in that sixth-class city. One bathroom for our family. We made it work. And also we have two in that top 10. Let's put more up there. I will tell you that there are some that aren't far. And then we have Oldham County, Kentucky, in the top 10 counties in the entire country by percentage that's responding. Let's do more. Let's do better. I think we're doing better against this virus. We can do better in this as well. All right, so each day we're also learning how to include each other a little bit better. Virginia has taught us so much about making sure that everybody's a part of Team Kentucky just by being here, that we started now, I think a couple weeks ago, at learning a little bit of sign language. And I can't tell you how many people I've talked to that feel more included because of it, that have learned a little bit more, and we're going to continue to do it. So today, we're going to say thank you to our police and our firefighters. So thank you, police and firefighters. Let's do it again. Thank you, police and firefighters. One more time. Thank you, police and firefighters. And thank you to those first responders and all of the others that are out there. Also, thank you to our social workers who are working really hard even through all of this and haven't been recognized about how difficult it can be to do their job right now, but they are still out there protecting people. So in addition to all of that we're asking of everybody, living up to our obligations, following the 10 rules, learning how to include more people, we also ask that you take all of that amazing behavior, all of those heroic acts, because remember, when you make the right decisions, you're protecting people, you're saving lives. That's a heroic act. And we ask you to put it online because when other people see it, it makes them more likely to do the right thing. And if we were passing a test of humanity, don't we want to celebrate in it as we go? Don't we want to cheer for our teammates as a part of Team Kentucky? So here's a little bit of what we've got today. All right, this is WKU. Great university. We have featured others at different points, but this is them showing compassion throughout their facilities, honoring those we've lost and letting that entire community know that you are not alone. And this is in Lebanon, Kentucky. This is their downtown, which is beautiful. And just again, we see this everywhere across Kentucky. People not only wanting to be a part, but to do something special, to honor their fellow human being, and to show that compassion to those that have family in the ICU or have even lost family. All right, our healthcare workers remind us every day what we can do to repay their heroic effort. Remember, these folks walk in to an environment every day where people have the coronavirus, knowing what it can do to them, knowing that we have lost a healthcare worker in one of our nursing home facilities. They're willing to do it. They're willing to help people, and we've watched those recovery stories in amazing videos, and we list the number of people recovered every day. It's because of their efforts. So what do they ask of us? Simply to stay at home because that protects them. Let's make sure we live up to that request and we answer it in the affirmative. All right, so we continue to see that we have incredible artists across Kentucky. You know, we always ask an artist, what's your medium? You know, what exactly, and how do you create your works of art? I mean, we have seen so many incredible, inspiring works. And let me tell you, I was talking to somebody today that I called on the phone to talk about something different. And you know what had made their day the day before? Walking up to one of these messages, seeing what's there. We don't just have to be there for each other as Team Kentucky based on the decisions to not spread the virus. We got to be there for each other at this time of anxiety. And this is one place where our kids are absolutely leading the way. All right. This is, again, one of our teachers who is doing an incredible job in this challenging time, still challenging their classes and the kids that they care so deeply about. But here, like our Lieutenant Governor, is another new parent that right now is facing challenges at home, but also has a daily reminder of why we're doing this. We do this right, hopefully, that baby's generation never has to face something like what we're going through. All right, I like this. This is Algie Smith from Russellville. He is ringing the bells at his church, being a part of Team Kentucky. And we've heard those bells ring at 10 a.m. Every day, everywhere, in all types of places, different houses of worship, different courthouses. A member of our Secretary of State's office, the day after we called for it, walked out to the rotunda and started ringing every single day. And even one day talked to me a little bit about why and who she's honoring. This is something special. Let's keep it up. It brings hope to all of us, and it remembers those that we've lost, and it lets those that maybe live alone and that aren't aren't surrounded by close family members, to let them know that we're out there and we care about you. All right, another one of our artists, again showing Team Kentucky and who our heroes in this truly are. And we appreciate her. All right, so let's first go into our testing update. Yesterday, we made the announcement that for our drive-up testing partnership with Kroger, that we were opening it up for everyone. Anyone who wanted to test could sign up. One of the reasons is that we were not seeing the number of signups that we wanted and that we needed, and people responded really in less than 12 hours. So Madisonville today, we tested 300. Our largest number there during the week, and our total for their 3 days will be 747. In Paducah, we tested 221. I believe that's 221 instead of 321. Our total is 521 for this was as of 4. We're going to have some more up until about 5:30. In Somerset, we had 212 as of about 4 o'clock. For 671 over the last 3 days. And in Pikeville, we had 276, but a big line in Pikeville as we were putting these numbers together for a total of 683. So over the 3 days, and this number will grow, we had 2,622 tests administered. We had over 1,009 today. Again, we've got more capacity that we want to reach, but this is one of the better days through drive-through testing that we have had. And here's where we are doing it starting next week. So remember, in Louisville and in Lexington, we're going to be going Monday through Friday. In addition to doing the tests, we will be providing masks and hand sanitizer. Our goal has been to locate Louisville and Lexington near predominantly African American communities because of the disparate impact that this has had. We have lost far too many people, and we've lost far too many people in general. But when you see the racial breakdown, you see the injustice, and this is just one way, in one small way. When you look at how long that unequal access to health care has been going on, we're trying to do something during this pandemic. So that's Monday through Friday. Anybody can sign up. Let's make sure we get as many signups. And Louisville and Lexington in those areas are going to go 2 weeks. Those will be the first 2 sites that we've gone 2 straight weeks. We're also opening up Owensboro and Bowling Green. Those are Tuesday, Wednesday, and Thursday of next week. So again, anybody can sign up. Let's make sure we use all of that capacity. Can we go to the how to sign up and put that up for just a little bit? This is the Walgreens. Can we put up the Kroger? Okay, here's the Kroger. Again, it's open to everyone. You do, because of the way the sign up go, need to visit the portal to sign up, and it gives you a time, so you don't just sit in line. And when you pull up, we do need you to answer the questions that they're going to ask in a straightforward manner. And now it's open to everybody. If you don't think you have any symptoms, tell them that. That'll give us data on those that might be asymptomatic, that are carrying the virus potentially. If you test positive, that's going to really help us know, and it's going to help you prevent it from spreading to anybody else. If you have had symptoms, make sure that you tell them that too. Getting good, accurate data out of this is going to help us make good decisions on reopening Kentucky in a safe way. How we respond to these testing opportunities is also your way to help us to make those positive decisions. Also, starting on Friday, tomorrow, our partnership with Walgreens at our facility in Lexington. This, because we'll have the other Lexington location, is for healthcare workers and first responders with or without symptoms, because again, you interact with so many people who we want to make sure that we get you tested, and any individual over 18 with symptoms. Again, you got to sign up online. It's going to run 7 days a week as long as we have the testing capacity. Lexington, in this instance, let's make sure we take advantage of that. And I was asked about, I think it was mainly here in Frankfort, whether we would have additional testing here in Frankfort. This is open to you. The Walgreens in Lexington, the Kroger in Lexington. If you live on the other side, the Louisville location too. Remember, just because you're not in that county doesn't mean you can't sign up. If you need a test and you are close, make sure that you sign up. Let's take advantage of it. Okay, Healthy at Work. We're going to have a update tomorrow about some of the steps that we are taking. But remember, we have the website and the email to submit industry or association proposals. We got to do it smart, we got to do it safe, and we got to do it gradual. None of us want us to reopen our economy in a way that sets us back, causes a spike that means more people have died, and keeps our economy closed for longer. We've had really thoughtful responses. We're working through them. Tomorrow, my chief of staff will talk about some of the discussions we've had, including local leaders as well. Our goal is, when we can have industry guidelines, that those will be, not just guidelines, they'll be mandatory as we are able to open up in different areas and in different professions. But remember, it's going to be gradual. It's going to be phased. Not everybody and everybody's profession is going to be able to open up in the very short term. Doing it right is about saving lives and making sure that employees will be safe and people they serve will be safe. But specifically today, we're going to talk about the first phased reopening we're doing in the healthcare area. I mentioned it yesterday, but Dr. Stack's going to walk through it in detail today. Let me say that in many ways, this is our proof of concept. if we create the right guidelines, if we enforce those guidelines, and if we do it gradually, that we can do this safely. And it's no mistake that we're doing it in the healthcare area, which ought to be the area that can respond the fastest to any issues that arise with the coronavirus, should be the most aware of the procedures, the PPE, and the rest, and ought to give us a good look at what this is going to look like as we do it in other areas. But let's also make sure that if you are a practitioner in any of these areas, that you are fully committed to following the guidelines that will be put out. Remember, we had to turn our recommendation on elective procedures and other steps into a mandate because there were folks out there that weren't willing to do it right. And just a couple of folks not doing it right can not only ruin it for everybody else, but will spread the virus. So don't be that person. All right? I mean, we can't be the folks that could ruin it for an entire profession and set our timetable back. So these are going to be some pretty specific guidelines. We're going to go over them broadly here. They're going to end up on our website. They're going to be incorporated into the action I got to take legally as we open things up. But Dr. Stack is going to walk through who's included and what's expected. And then at that point, we'll talk about long-term care. The metrics on the further metrics on the Healthy at Work, we're going to have to provide tomorrow because we got so many questions today on this specific area. And given that it's coming as early as Monday, we think it needs the majority of our time. Dr. Stack.
Thank you, Governor. I didn't realize you have a mug, but I have a book, and so that's been noted apparently. And thank you to the person who made the beautiful book for me. I can't in 5 minutes go into the level of detail we need, but I do need to try to convey the concepts we're working with, some level of detail so you can start planning, and I'm going to attempt to do that. I'm going to ask you all to please, we'll post the slide deck online so you can at least see that. Hopefully we can do that tonight, and you'll be able to see what I share on TV. But then I need you to look for the guidance, which we'll try to get up as quickly as we can. You'll remember the difficulty we had in shutting everything down. There's more questions created by what we're trying to do than we can give answers fast enough. We're going to work as hard as we can to give you the certainty that you need. Thank you for working with us in some measure of patience, because it's difficult on all of us, but it's certainly hard to shut things down and then turn them back on and do it in a methodical way. So Kenneth, if you could show, or James, the first slide, please. So on this, and this is a difficulty, I had a mistake that I caught, so you see it lined out here. It won't be that way on the website. On Monday, April 27th, we intend to resume non-urgent, non-emergent healthcare services. So this means we're going to resume regular medical services in certain settings for certain purposes, and diagnostic radiology and laboratory services. So we're going to do this starting on Monday the 27th. I gave examples of settings where this applies. Healthcare clinics and medical offices. The line, I typed it wrong, so the first one I deleted was outpatient hospital services, things like that. So if you're going in for laboratory services or radiology at an outpatient department for a hospital, you can do that. Physical therapy settings and chiropractic offices, but listen to the end because you're specifically mentioned on the 5th slide. Optometrists and dental offices, and I find, when I think about medicine, I include dentistry, but it's very clear that that's not the way it's understood. So I'm got to call out dentistry specifically. You have a parenthetical here with enhanced aerosol protections. I'm going to come back to that. This is not an optional thing. This is required. I need your help, but I've already gotten all sorts of communications that dentists are ready to open up on Monday for normal business. If you do that, you won't be following the guidelines. This does not apply to long-term care, prisons, other industries, or other settings where there's separate guidance. Okay, so more will come. I'm sorry, Virginia, I realized I was talking too fast. I'll slow down. So this is a slide 2, James, please. So this is a phased gradual reopening of services. The governor just said that very clearly. This is intended to be a phased gradual reopening. so we can do it thoughtfully, safely, and see the consequences of these actions so we can take adjustment correction actions if we need to. Still, we want in all phases telehealth maximized rather than in person. When we go through this transition and when we emerge at the end of the coronavirus, telehealth should have a larger role in our lives. That would be a good thing from this virus. No visitors allowed in healthcare facilities, just like is currently the rule, unless they're required for vulnerable populations, minors who require an adult. The situations that currently they're allowed will be continued, but there's no new relaxation in the visitation policy in healthcare settings. Eliminate traditional waiting rooms and common seating areas and use non-traditional alternatives. There's a lot of doctors' offices who have done things like the parking lot lobby where you sit in your car and you get a text to come in. That's going to have to be part of our lives for a while ahead, so please continue to do that. Maintain social distancing greater or equal than 6 feet in all settings where people have to wait for whatever reason, and minimize direct contact between individuals. That can take place by adjusting your processes, by also installing barriers where there's a plexiglass barrier between people, like when you go to a bank teller or a pharmacy or other settings where that's in place. Next slide, please, James. When people arrive at your place for medical care, you should screen them all with temperature and ask them a quick questionnaire. Do you have any signs or symptoms of coronavirus, like fever, cough, shortness of air? You should do some screening for your employees and screening for the patients who come and anyone who enters your facility. That's our new normal for the foreseeable future. Plan for and ensure enhanced workplace sanitizing, wiping down surfaces, things that are high touch like doorknobs, countertops, things like that. Same thing for enhanced hand hygiene, washing your hands for 20 seconds with soap and water, and using hand sanitizer on a regular basis, and certainly after you touch things and come in contact with other people. Please provide hand sanitizer easily accessible throughout your facility so people can use it, and encourage them to do so. And this last bullet is really important. The normal healthcare delivery system has to be able to procure its own PPE. The state won't be able to buy it all for you and give it to you. We still are trying to acquire PPE because we still need to have it on hand to help support people and institutions if we have a surge of coronavirus. And we will still work to try to support where there are critical gaps. But it's not intended, an emergency response system, to be the normal routine to get resources to run normal healthcare operations. And this is one of the reasons we have concern, is we try to accommodate the need for medical care about being cautious that all of a sudden we're not consuming PPE at a rate we can't sustain, and that creates the very problem we're trying to solve right now. Next slide, please, James. In all of these healthcare settings, and in fact in the rest of our lives in other ways, but we'll come back to that on a different day, you can expect masks to be more a part of your life. I know when we talk to you on TV, we're not wearing this here out of just a real practical requirement for you to be able to see our facial expressions and hear us clearly. But if you go into a hospital, all of the healthcare providers in the hospital and every other staff member should be wearing a surgical or a procedural mask of some sort. Not cloth, the surgical or procedural ones. They're inexpensive, but they're a different quality. Everybody coming into a hospital or an acute care setting like that also should be wearing a surgical or procedural mask. And so the facilities will probably have to provide those. Since there's not visitors, there's only patients and a very limited number of people to assist selected patients. That hopefully won't be overly burdensome, but it's necessary. In a doctor's office or a clinic or an outpatient testing place, patients coming in and anyone else should at least have a cloth face covering or a cloth mask. And so that would be acceptable in those other settings. But we are attempting, remember, to do source control, which means minimize what comes from your mouth infecting someone else. So you're wearing it to keep you from infecting someone else if you have the coronavirus. Next slide, please. And this is the final one. There are a couple special considerations. I don't want to call out single sites of service and single clinician communities or any single industry, but there are times when there are unique distinctions and they have to be identified. The two I've put on this slide are high-touch environments. So if you do physical therapy or you do chiropractic, and there's probably others that I just haven't thought of or put in the list, you are touching people. You are physically in intense contact with someone. you have to take extra precautions. So you have to do all the other stuff everyone else does. But you also should be wearing non-latex gloves when you're contacting someone. Remove those gloves and discard them. Sanitize and clean your hands. And then you should also be taking extra precautions for anything you use to provide those services. So physical therapy uses a lot of devices and adjuncts. And if you're going to use things to touch patients, you have to take extra measure to sanitize all that stuff between patients so we don't spread infection. And then here's the dentist. Remember I said stay tuned? Gosh, in Kentucky we need dental care. So first of all, thank you for what you do. I want you to know how important you are. But you've got a big challenge as a community, and I would like your input. So please give me your input. I know that there's a group working, and I don't have the whole list here, but I know there's a large group working together, the boards and the associations. Thank you. I look forward to your input. But you are aerosolizing oral secretions all the time. A dentist's office is far more intense than a typical putting in a breathing tube like I do as an emergency physician, because you are constantly spraying oral secretions. So there's probably going to have to be enhanced protections like N95 masks on all of your staff who are directly providing services, the hygienists and the dentist. And then I don't know how you address the airflow considerations in your office and how you address the enhanced surface cleaning needs, because the aerosolization spreads for multiple feet. So I'm not trying to single out dentists in an adverse way. I'm just saying you have unique challenges that have to be addressed. The same thing, though, holds true for oral surgery, anesthesia in an operating room. They may have to have N95s to intubate, pulmonary services. We look forward to your further input. But because I've qualified this, you would be misunderstanding if you thought it was safe and correct to open your dentist office for normal business on Monday with the normal procedures you were using before we shut everything down. So I know that my email will light up after this tonight, sir, but I look forward to your input, and I want to thank, we can't shout out to everybody, so forgive me, but the Kentucky Medical Association, Kentucky Hospital Association, Kentucky Association of Chiropractors, Kentucky Chiropractic Society, the Kentucky Optometric Association are just some of the feedback or input I've already gotten. I want you to know we read this stuff, we're relying on you, and we want to work with you. But we do have to do certain things differently after this if we're going to keep everyone safe. Thank you, Governor.
I'll take all my notes.
Oh, I'm sorry. You could actually have all mine, too.
I think Dr. Stack made a real good point at the end there that is going to apply to everything. Your business cannot look the same when you were able to gradually restart it than it did before. If you're thinking about a waiting room, no, we can't do that. That's where it spreads. If you're thinking about everybody that used to come in, whether it's certain administrative staff, maybe billing, you figure that out. No. If they can operate via telework, they ought to be. And if you were envisioning, opening whenever you can open in the same way, that's not going to work. And ultimately, it's not going to happen, right? So to do this safely, you're hearing all of these thoughts and procedures that we're putting into place. Make sure you are going above and beyond. This is our proof of concept in the medical community that is used to dealing, while not with the worldwide health pandemic, but other contagious viruses. We got to prove that we can do this and we can do it the right way. So make sure you're committed. Make sure you're thinking through every single piece of the business. Understand that these aren't going to be suggestions. They're going to be requirements. We are willing to work with you on them, but our job is to make sure that people are as safe as they can be while we are providing these additional healthcare services. And let me say, we need to provide the additional healthcare services. People can get and are sick with other things. We need to make sure that we are taking care of them as well. All right. Next, I want to talk a little bit about, before I do that, wanted to thank the Kentucky Organ Donor Affiliates and Kentucky Circuit Clerks for donating 1,500 COVID-19 swab tests, which were delivered to our DPH warehouse in Frankfort today. These are kits. These are tests. It is still hard to get them. 1,500 additional is a big deal. We really appreciate what they do. They're on the front line to ensure the process of organ donation and transplantation happens even in the midst of this pandemic. Our circuit clerk staff members are on the front line in their courthouses. Although not currently issuing driver's license, they've helped add over 2 million Kentuckians to the Kentucky Donor Registry. And every year, April is National Donate Life Month. So this is just folks that do this type of amazing work looking out for people every single day, but stepping up and helping us better protect people through this donation. Before we get to the numbers, what we know is that this virus is hitting our senior living facilities, our nursing homes really hard. And it's not just us, it's everywhere. It is absolutely everywhere. We saw it happen in Washington first, and it's hard. It's hard when it hits one of these facilities logistically with a number of people that quickly become infected. It's hard on us emotionally coming into a situation like that. It's hard on the individuals who are trying to deal with that virus, especially if they're in some of the facilities that are providing really significant services. So I want to ask Secretary Freelander to talk a little bit about some things we're doing at some specific facilities like Jackson Manor, but also, again, to just talk about how much work we're doing. And without that work, we'd be losing more people. Don't get me wrong, this virus comes for some of our most vulnerable, and we're not going to be able to stop it from taking everybody as we've seen. Our job is to fight as hard as we can alongside those that are working in the facilities and in our hospitals to protect as many people as we can. Secretary Freelander.
Thank you, Governor. Dr. Stack, I'm stealing your book. First, I want to say that we are working very hard to address the issues that we've seen in long-term care facilities. We would not be in as good a shape as we are today had we not stopped visitation as early as we did. Thank you. I also want to say that we talked about opening. This is not an area we're talking about opening. This is an area that we're talking about giving greater scrutiny. We've started testing full facilities. We've started testing places like Ridgewood Terrace, Rosedale Gardens. You've heard us talk about the Hazelwood Center. We've tested all our clients there. We are beginning and working on ramping up our testing for all long-term care and working on a tiering system for testing those that need the most help. And we have been providing help. Anytime a facility has a positive resident, our infection control team through public health, our Inspector General's office, we have been working with facilities to address their needs and to figure out how we can help them and support them. Norton Healthcare has been a partner. They have stood up their call center. They are providing support to facilities around when they make decisions to transfer residents, when they make decisions to ask for more testing, when they need more support on infection control so we can walk them through those procedures and help them. Mostly they need to know that someone is out there willing to help, willing to support, and we found that on many calls, that's what is most needed. So we've made some changes into what we expect in the Inspector General's office relative to what we allow in terms of emergency medications for facilities. We have been working with coming up and working with our Norton Healthcare partners and what we're doing with how we work on our strike teams, how those folks who will go in and work with facilities, sometimes virtually, sometimes there's a need for folks to go in directly. We have provided some staffing support to several facilities across the state. So we are working very hard with facilities, with our partners, to provide additional guidance. The task force that we talked about, that guidance is out. It's on the Inspector General's website. It gives guidance for when folks should and should not transfer. We will have additional behavioral health supports we provided to facilities, and we will provide additional guidance on that as well. And lastly, Jackson Manor. I reached out to Judge Gabbard today, and we had a very good conversation. There were some communication issues, but at the end of that conversation, he was letting me know how much he appreciated our support and how much Jackson Manor appreciated our support. We are going to retest many of the folks in Jackson Manor to make sure that we are cohorting correctly there, that we're supporting them there. We have provided some PPE there. They are reporting through our web EOC, which every nursing facility needs to do, every long-term care facility needs to do. We need to understand what your needs are for PPE, what's your rate of usage, so that we can appropriately, with the precious supplies that we have, so that we can appropriately provide some support for PPE if a nursing facility needs it. But they need to report to us what they need. They need to report on a daily basis. So communication is important. And like I say, at the end of the conversation with Judge Gabbard, he was very, very kind to me. And I said to him, you need to advocate for your people, and we appreciate that you do that, and we support you in doing that. If there are communication issues, we are going to work through them, and we're going to get through it, and we're going to get through it together. Thank you.
Sounds right. And Web EOC, which he mentioned, is our portal whereby all of our healthcare providers, our assisted living, nursing home, and other facilities report their PPE every day so we can see their burn rate. That's what you have to do to be qualified to get the state reserve. That lets us know when people need it at the time they need it most, to make sure we're not sending a bunch in this direction when somebody over here is about to run out. All right, so today's numbers are better news than we had yesterday. And it's hard to say something's better news when you're still reporting positive cases and you still have people who passed away, but the numbers on both are lower than the day before. So we have 161 new cases of COVID-19 that we are reporting today. And when we remove, again, duplicates and others, our official number for the state is 3,481. Total number tested, 42,844. That is a jump of 6,769. While they didn't all happen yesterday or the day before, they do show in the last 3 or 4 days we have been having a significant increase in our testing. Number of Kentuckians ever hospitalized, 1,115. Currently, 302. Ever in the ICU, 570. Currently, 163. Let's think about them. Number recovered, 1,335. We want that number to continue to grow as a percentage. It's pretty good compared to the number of cases, especially when we see how long it takes to recover from this. New cases by county, and I would point out that this is the best information that we get. Sometimes it's where people are tested. It's not perfect, but it gives us at least an idea and a concept. And let's remember that the virus doesn't care about county lines. So even if we miss a county and they live in a contiguous county, it's not like the virus isn't in your county and can't move back and forth between the two. So it's 75 in Jefferson, 38 in Kenton, 13 in Butler, 9 in Hopkins, 3 in Adair, Boone, and Marshall, 2 in Bullitt, Callaway, Campbell and Grayson, and Jackson, and 1 in Carlisle, Grant, Hickman, Muhlenberg, Ohio, and Washington, and 1 that is unconfirmed. Today we're also having to report 6 new deaths, and these are, again, 6 more Kentuckians that we have lost the coronavirus, for a total of 191. And while that number is so much lower than any prediction would have been to date, and that's because of the good work of Kentuckians, it is still 191 people that we didn't want to lose. And so let's make sure that we light our homes up green, that we ring the bells, that just because we have a lower number doesn't mean these 6 individuals are any less important than any other day. Their families who are going to go through a very difficult time, and a difficult time to go through it, deserve our continued support. So again, with each one being more than an age and a gender and a county, and that's what we get to report. 68-year-old male from Eulenburg, 62-year-old female from Jefferson, an 87-year-old female in Adair, a 73-year-old male, Henderson, 77-year-old male, Jefferson, 93-year-old female in Kenton County. Breaking down the racial and ethnic data, we know the information on race, and 78% of all cases, and amongst that, 76.3%, 36% white, 13.48% black or African American, 5.13% Asian, right about 5% multiracial. In ethnicity for all cases, we know 73.36% of that data for the total cases, 92% non-Hispanic, about 8% Hispanic. The data on deaths is tougher. On the racial data, where we know 85% of total cases, 79.27% white, 17.68% black or African American, 1.83% Asian, 1.22% multiracial, and on the deaths, 98.73% non-Hispanic on ethnicity, and 1.27% Hispanic. But again, these people are more than names and numbers, and so today we're going to show you Patsy Carol Stith. Patsy Carol Stith passed away on Monday at St. Elizabeth Hospital in Fort Thomas. She was 76 years old. Patsy was an active senior who enjoyed yard work, gardening, and making crafts. She had self-quarantined because, like many her age, she had some at-risk factors. But despite her isolation, she started experiencing flu-like symptoms. Patsy was admitted to St. E's on April 4th. On April 6th, she tested positive for COVID-19. On Monday and Tuesday of that first week, Patsy FaceTimed with her family and seemed to be recovering. But her situation declined, and by Friday, she was in the ICU on a ventilator. Patsy rallied and was able to come off the ventilator a week later, but too much damage had been done, and she passed away about 2 days later. Patsy was a mother to 3 sons. She was mamaw to grandchildren and great-grandchildren. She has a sister and brothers, and along with many friends who will miss her, and we will mourn their loss as well. So let's make sure that we are thinking about Patsy, knowing that when we lose somebody, it's not just another number, it's not a comparison with any other state, it's an individual that will be missed. And while we're going through this, we also lose individuals to other causes, and we lose our frontline heroes sometimes to other causes. And so today we wanted to share from the Hopkins County Sheriff's Office that it was with a heavy heart that they announced the death of Hopkins County Sheriff Deputy Terry Vick, age 43, of Greenville. On April 22nd, Deputy Vick was involved in a fatal traffic accident on the Western Kentucky Parkway. He was a school resource officer at Hanson Elementary, but had just completed an overnight security detail at Madisonville North Hopkins COVID-19 testing site. He was helping people who were getting tested in this crisis. He was a husband, a father, a former Marine veteran, 17-year law enforcement officer. Kentucky State Police are investigating the accident, but tonight we're remembering Terry Vick and all of the things that he contributed for us. Before we open it up to questions, let's go through very quickly some areas that we have been tracking for you. We're not going to show Western State because it is stable as of today, and that is good news. But Green River, we have one new case, and it is one new inmate. We're going to have at least a video from Secretary Noble tomorrow talking about the efforts that we are making in this facility. Long-term care facilities, one of the reasons why Secretary Freelander talked today, continue to be a very tough area. We have 32 new residents that have tested positive, 27 staff, and we have 9 new deaths, though remember that number is higher than today's report because it comes a couple days later, potentially, that those that we know who have passed away are from or in long-term care facilities. Listen, this is about 44% around that, I think, of our overall deaths. It's an area that we're working really hard on. This is also where the virus truly devastates. And as we're doing our reopening, let's remember that somebody can be asymptomatic and can ultimately spread it to a facility like this. So just because we might be seeing low numbers in one county or one area doesn't mean that someone asymptomatic can unintentionally spread this virus to one of these facilities. This is why we have to be exceedingly careful. People are depending on us. All right, we have 4 reporters with us today, and questions from those that couldn't be there. We have Stu Johnson, Philip Bailey, Bobby McSwine, and Karen Czar with us. So I'm going to start with the written question, and then we'll go to Stu. One day this week, we were told the number of people that had died, so many were nursing home related. Of the total number of deaths, can you tell us how many were nursing home related? So we are 86 of today's total, which is just under 200. So 40+%. It shows you how important protecting people in these facilities are. Stu.
There are 12 counties, according to the COVID-19 map, that still don't have confirmed cases of coronavirus. I know you said that you believe that there are people there that are infected. Would you anticipate a surge maybe in the summer or the fall in areas like that in the state?
The question is with the counties. I think you said maybe there are 12. I think there might even be fewer than that haven't had a confirmed positive case. Would we expect a potential surge in that area in the fall or during another time? We think it's already there. And it's already there probably at a level it is in other places. It's just the way this virus works. Some people are asymptomatic. Some people are just a little symptomatic. And some people who get it, it just, whether they're healthy enough beforehand or the way it impacts them, they can ride it out without additional help. There are some that may have tested positive in a hospital, but the data could potentially be reported in another county. I think a county is way too small of an area to be looking at it singularly. And that's whether we might have a surge or what the overall infection rate is or even on the reopening. Because, again, this is a virus that, one person can potentially spread to hundreds, which we've seen. And we've seen some examples in our state and out of one event and what it can do. So I think we got to be really careful about analysis on the county level, either in the spread or in the reopening. At different times, we may be able to look at regions. We may get the data to where we can look at regions, but an individual county is always going to be a little small. And especially when you look at the map and maybe you got one county that's been hit hard and one county that doesn't have a reported case and the next county around them is a medium level. We know that it's there. Mike Valenti wanted to ask about business reopening while following the guidelines. How will the measures be enforced? So they will first be published. They will be a part of the executive order easing those restrictions. Again, we've got our labor cabinet and others that will be out there ensuring that we have enforcement. We're going to ask our local officials to help us with that. Our hotline for reporting noncompliance is still going to be open. And that's not it's a good thing. It's a good thing. We got to do this smart. And if we're giving people and professions the opportunity to start reopening, it's got to be gradual, and it can't look the way that it did before. And remember, if just one group does it wrong, we can spread the virus. And so, yes, we're going to have enforcement mechanisms in place to make sure that we do this right and that we don't frustrate the progress we've made. Bobby.
I was speaking with a viewer yesterday, and she told me that her fiance has been laid off for 6 weeks. They've been applying for unemployment for 6 weeks unsuccessfully. Basically, they've been calling the office, mostly getting a machine, and when they do get a person, they're referred back to the website. and get another error message. So basically just going in circles for over 6 weeks and not getting a dime in unemployment. So she wants me to ask on her behalf, what can they do at this point?
The question is on unemployment and a viewer struggling. First, before you leave, if we can get the name of that individual, we want to certainly help that individual directly. But more broadly, we're signing more people up every day than ever before. We're also facing a volume that we have never seen. And I know that significantly frustrates folks, and they feel like they're in a never-ending cycle until it happens. That's not right. It's not okay. That's ultimately on me. We are hiring people every day, and we're working on that website, the server and the machinery every day as well. We are still suffering from a legacy system that was designed to tell people no at a time when we're telling them yes. And every day we're making progress, but that progress isn't enough if it doesn't include your viewer. So we're going to continue to try to do better every day. We can have another update on that tomorrow, but we've prioritized some areas like this that are really frustrating. One is people who are 2 weeks behind on payment that they should have received, because we have that issue too. And so we're trying to do better each and every day, but there's no question that we're not getting to everybody we need to right now. I will admit that, and I will own it, and we will do our best to do better every day. Franklin County resident wants to know if the county will have testing again that is open to its asymptomatic folks. You can go to Lexington, you can go to Louisville, which are the two closest places right now. It is open to everyone. If you think you need a test, you might be asymptomatic, please do it. Quick question, and then we'll move to the next. How are drive-in theaters affected by these closures? Well, first, they have provided an opportunity for folks to still have an experience in areas that in-person services have had to be limited. Everything from our houses of worship to options now for graduations. That's as long as everybody follows the rules, and they're really important. Only one family per car. It can't be outside your household unit. You can't get out of the car, and we shouldn't be passing things in and out of the car. I will say that it's provided us an opportunity to still have some experiences that I will tell you a lot of other states haven't allowed. When anybody looks at the actions that different states are taking right now, a lot of the actions they'll say are reopening are allowing curbside service at places, which we've done, are allowing drive-in type occasions like this, which we have always allowed. So this has been something that has helped our people and needs to become a little bit of a norm for the near future, because even as we get closer to ending phase 1 and phase 2, big group gatherings are going to be a real problem. So let's continue to use these methods. It's going to help all of us to feel more connected. Karen.
A lot of people are asking, they really want the antibody testing. Of course, you said the other day, of course, we're limited. But is there a time frame under when we know they'll be more available in Kentucky? And do we know the percentage of the accuracy of them? And if so, could we possibly get a list of where people could get them once they can?
I don't think we have widespread antibody testing that is available now. We are still waiting primarily on the institutions that think they're going to be able to do them. We don't have an answer yet on what that capacity will be. And as Dr. Stack talked the other day, there's a different use for them. It's going to provide some good information for us, and that information will be more useful once we learn the level of immunity, if any, that people have who have been through it. If there isn't any significant level of immunity, then one of those tests isn't going to be as helpful, other than knowing how widespread the infection can be. But we are hoping for any and all forms of testing. Now, as we get more testing, it does make it a little more complicated to say where we are and where we're going. And for that, we have got professionals like Dr. Stack and Secretary Freelander to help guide us through it. At what point did the priority to give COVID-19 tests to anyone who wanted one, giving a test, change to those who met certain criteria? Well, what we found out in the second week of our drive-through testing is that those who fell in the criteria weren't taking up the full capacity and weren't even taking up a major percentage of the capacity. We've also had a separate program, that's the 12,000 kits we get from Gravity that we have been sending to hospitals that have been testing those first responders. So what we're able to do now is to say, okay, if those 12,000 are aimed at our nursing homes and our prisons where they're needed, and for our first responders, those areas of priority that could be hotspots, let's look at where our drive-through testing can be best used. And so that was one of the major moves that we made, or one of the major drivers to that decision. Phil.
Governor, in the Healthy at Home proposal website, some have told me the application focuses mainly on retail and manufacturing. Does the administration have any thought or guidance to establish any separate guidance for those higher education institutions to bring the faculty, staff, and students back to campus responsibly?
That's a good question. So the question was, the Healthy at Work website is set up a lot for front-facing businesses and industry, and you're right, it is. And thoughts about higher education and where and how they can bring back their faculty. That's work we need to do on that piece. We have been communicating regularly, especially with CPE, on that, but that'll look different. You're right. That plan will look different and has a lot more potential for telework as well than a number of other facilities. So that's a little bit of work and variation that we need to do. So I know it's a question, but it's a good idea. It's something we need to be doing, and we'll work towards it. David Scott, WDRB, with 4.5 million surgical gloves, 1.4 million surgical masks, 1.2 million respirator masks. I like hearing that because this was really hard to get, taking weeks upon weeks of hundreds of leads that turned out to be false. Do we have enough, or what will be enough? So that is a question that is as much science as art. So right now, that supply is for two things. Number one, it's to provide to our different healthcare facilities, our nursing home and others, as they reach a critical stage. And we are providing more and more of that. A whole lot of our reserve came in all at one time, thanks to a couple of really good partners. And we're seeing more go out on a daily basis. But the other thing that we've got to do right now is we have got to stockpile enough for a second potential surge. When we look at any of our graphs on this, St. Louis being one, we know that there's a future potential. And as we're opening up, while the virus is still out there, we know that there's a potential. So we have to have a reserve amount and an amount to help those that need it. And so it's both science and art, but 31-day projected needs just in regular in regular activity in some of our facilities could reach 4.7 million gloves, short of 1 million surgical masks, little 50,000 less than 1 million in N95 masks. So, these are big numbers that are needed in the healthcare sector, and they're going to continue to be. Stu.
Follow up on Dr. Staff's comment about dental care. And I guess you mentioned that it's not going to start back on Monday, but when should Kentuckians expect to be able to resume going to the dentist for?
Question is on dentists, and given the extra part of their practice, and how soon could we expect it to start up? This is an area that Dr. Stack is working on very hard, and once we can get acceptable recommendation and guidelines to protect the staff and the individuals and address what makes it a little bit different than others, then we want to work towards that as quickly as we can. We know our folks need their dental care. Bobby? No? Karen?
With the cases at the Tyson plant here in Kentucky, 54 at minimum, the Green River Health Department told me that they are investigating. Everyone seems to be cooperating. I've not heard back officially from Tyson, but they, in a statement, did say we're doing what we're supposed to be doing. Are you getting complaints still from businesses, from employees from businesses saying my business isn't complying, or are you concerned that if you're in a large team, this is going to be happening.
Question is about complaints, level of complaints we're still getting from employers. From employees, they're down significantly. Our calls are down very significantly. And I think it's for a couple of reasons. One, and we're trying to be out there with enforcement. And two, a lot of the essential businesses have made very substantial changes. And we're going to have to see more changes as we go forward. Our new normal is gloves and masks and potentially different capacity than we've seen because of the need for social distancing. And I think that many of those essential companies have realized the threat of a widespread outbreak at their facility. You know, if it shuts you down for 2 weeks, you lose more capacity than if you spread people out, you do things right, and maybe you run at X number of percent, but you're not down. But still, there are places that from time to time we get calls that are operating the same way as before the virus started. Until we have a vaccine, we can't be doing that. Phil.
Governor, I know your counterpart in New York, Andrew Cuomo, had some pretty harsh words for Senator McConnell. One, have you spoken to him about funding for cities and states, particularly as Louisville faces now a $115 million shortfall? And what do you think of Senator McConnell referring to that part of the coronavirus package as a blue state bailout?
Have talked to McConnell or Cuomo?
Senator McConnell.
Okay. The question's about Governor Cuomo in New York had some words today for Senator McConnell about his comments on funding for state and local budgets, and if the state does not, if the next CARES Act package does not include budget assistance for states and counties, we will be hit with a rougher recession. It will last longer, and it will be harder to dig out of. We will have more unemployment in Kentucky than we need to during that period. We'll have to cut vital services. It'll impact infrastructure. It'll impact our ability to care for those that are most needed. It'll hit public safety in a really significant way at a time than we need it. We'd see issues with staffing for education, police, and fire. I mean, it is a real crisis there too. So the next package must include that relief. We've communicated with the senator's office. The last time I talked to him about this, I think, was probably a week ago, about the need for it, and I've continued to press it. States can't declare bankruptcy. There's technically a legal way, but that puts a judge in a position to potentially raise taxes on everybody across Kentucky, and we can't have that while we're going through this. And you hear political statements going back and forth. I mean, this is necessary. We don't have it, we don't crawl out and restart and rebuild. It will cripple our efforts to rebuild if we don't see an aid package, not only for states, but cities and counties. And right now we can't use any of the CARES Act money for budgetary relief. And it's not just a problem for us, it's for every city and county in Kentucky. Last question comes from Brian Walker at 98.3 WQXE. What is the thing I've most enjoyed or found most comforting during social distancing? I've had dinner with my family every night. This is a hard time, and it is difficult to live through, but I've had dinner with my family every single night, and I can't remember any time, probably since they were born, that was the case. None of us are going to look back at this time and think that it was good for just about any reason with what we're going through. But I treasure those moments. I feel more connected to my kids' lives, mainly because they're not going anywhere, but certainly more connected. And that helps with what I have to do and with what so many of you all are having to do or go through. Just that connection gives me energy every day. All right, so I know we went over today, but Kentucky, we got to keep it up. Remember, we've sacrificed. We're now in patience and planning, and then we move into perseverance. We are going to reopen this economy. We're going to do it gradually, and we're going to be the smartest, not the fastest, but the smartest. We've got to do it in a way where we have long-term success and we protect each other's lives. And so we're going to end today with a Team Kentucky video that KYT put together. It features a number of Kentuckians that you know well. And remember, this Team Kentucky Fund is going to be used entirely to help those out there impacted by this virus and to help lift us up. See you at 5 tomorrow.
Right now, we're all fighting the coronavirus as part of Team Kentucky.
And while we're united in this fight, we're still separated into two groups. Those who can help and those who need it.
So I'm calling on all of those who can to donate to the Team Kentucky Fund.
Your contribution provides assistance to Kentuckians who have been financially impacted by the COVID-19 emergency.
So if you can, please donate to the Team Kentucky Fund at the address below.
And thank you for standing for Team Kentucky.